Carolyn?
First of all, I'd like to thank the Baroness for her comments. And as she was speaking, I was reminded of a book I just finished reading called Too Big to Fail. Anybody read it? And it's a great whodunit, and it's about the financial collapse of September 2008. And unlike a really good whodunit, you don't know who done it. But you do understand the consequences associated with that notion of a collapse. And one of the things that went through my mind when I was reading all of the homework I had to read for this presentation was whether or not the reforms will have some unintended consequences associated with the National Health Service being too big to fail, because that's what happened in the collapse and the attempt to prevent the collapse in the financial markets was in an effort to prevent the failure. A whole series of things unfolded that created unintended consequences that we're living with. So for me, one of the cautionary notes around the conversation in respect of the massive redisorganization of the National Health Service is the fact that there will be unintended consequences associated with that. And at the end of the day, those consequences affect patients and their families or the recipients of service. We had the opportunity at St. Joe's to be in the UK last year as part of our Leadership for Performance Excellence program, which was sponsored by CHQI at the Change Foundation. We were learning from the UK, from the National Health Service Institute for Innovation, about releasing time to care, an innovative program that helps to release the capacity of staff at the front line in order to give them time back. And one of the things that really struck me when we visited the organizations, big organizations undergoing a lot of change, University of Manchester, hospitals in Nottingham, was how the organization and the leadership of the organization, with the support of the National Health Service and the Institute, had managed to deal with significant change and managed to engage the front line in order to make changes that had real impact on patients and their families. So for me, one of the concerns around, and a lesson for Ontario around the redisorganization of the National Health Service, is a concern around the ongoing ability to be able to continue to support the really important changes that were made that we learned from in Ontario. So for me as a CEO of a hospital, one of my worries is that as we begin to approach the system reorganization that will have to occur, because there is no alternative. I hadn't heard Tina before, but Tina actually applies in this particular circumstance. There is no alternative to making changes that need to be made, because the health system isn't sustainable in the way that it's currently unfolding. But as we do that, we need to be really clear that it does take leadership, and it takes really good leadership and attentive leadership. And I would hope that while Ontario has looked to the UK in order to learn from really great practices and how to make significant and transformational change, that there won't be an attempt to, as we try and deal with the significant financial challenges that we have, to reduce the leadership. Because if we remove the leadership, people really do hunker down, and they do what they know how to do today, or they retreat back to what they knew how to do yesterday as a way of buffering themselves from that kind of change. So one of the concerns that I would have as a leader in Ontario is that we might find ourselves in a situation where, because we've looked across the Atlantic Ocean for advice, that we might suggest that pulling a significant layer of leadership out as a way to deal with the financial challenges that we have might sound like a good idea to start with, but generally speaking, it's not a good idea over the long term. So for us at St. Joe's and me as a leader, I think that the key things that we learned from the UK were that leadership does matter, focused attention on metrics, and holding people accountable for the delivery of those metrics was absolutely critical, and how important it is to hold the leader accountable, and the most senior leader. Ross talked about blood on the floor, and there absolutely was blood on the floor in the UK if you don't deliver. And for me, that holding on to that particular piece is really important. The Excellent Care for All Act actually begins to hold me accountable. Although at St. Joe's we didn't have to wait for the act, I've been held accountable My performance has been at risk as long as I've been a CEO based on my ability to perform and deliver improved quality and safety for our patients. So for me, that's absolutely critical to continue on with. In terms of other things that we learned that are key, were key learnings from the National Health Service transformation, was how important it is to engage from the bottom up, and the Releasing Time to Care initiative, which is really about helping staff at the point of care, providing care to patients, learn how to take control of their work environment and to improve process, get rid of waste, save time, and increase their capacity to care. Watching that program unfold in the UK and then watching the experience that we've had at St. Joe's with engaging staff helped us to actually improve our performance significantly. When we were in a period of performance decline, we actually lost our way a bit in terms of moving forward with our quality agenda. So looking to the UK and understanding what it takes to engage from the bottom up while you lead from the top down on quality and safety to help to create a sustainable health system was really important. And that can get lost as well when you do massive disorganization, because staff will start to hunker down and lose some of the skills that they've been taught or that they've developed over time in order to make a difference to their work. The last thing that I would say is that one of the things that we've learned is critical on the leadership front is the importance of the role of the board in holding people accountable, setting the tone for improving overall quality and safety. We learned that from the US, the IHI, as well as from the UK, that leading from the top down around quality and safety will actually help you to deliver a sustainable health system. And that it's been helpful for us to be able to take that leadership and drive it down to through the senior leaders as well as to the operational leaders. And if we get into another situation where we're disorganizing in Ontario, we will actually lose some of the momentum that we've had in organizations that have been relatively more successful up until this point in terms of improving overall quality and safety. The last thing I think that I want to say is I've been in healthcare a long time, 35 plus years, actually 38 years. And so I've been through a lot of disorganizations, both here and in British Columbia. And one of the things that emerges through those disorganizations is the view of staff and physicians that this too shall pass, and we'll go back to where we were comfortable a couple of years ago. And if during any kind of reorganization and transformation that emerges here in Ontario, if we go back to this too shall pass, we'll lose a huge opportunity. We will retreat back to a place where patients and their families waited too long for care. Outcomes weren't reliably delivered by professionals, and that won't be in the best interest. But most importantly, we won't be able to deal with address the issue that the system is not sustainable. We simply cannot continue to fund the system the way we have been funding the system, and that it is absolutely possible to improve quality and improve safety and reduce cost at the same time. We've seen it in the UK. We're beginning to see it here in Canada, and I think we'll start to see that in the US as well. So I'm going to stop there and hand it over to.
Thanks.